Hi, I'm Susan Conover, co-founder and CEO of Piction Health. Today I'll talk to you guys a little bit about how we've built a clinical decision support tool to help frontline providers quickly and accurately identify adult rashes with the accuracy level of a dermatologist. My conflicts are I'm co-founder and CEO and a stockholder of Piction Health. So today I'll talk to you a little bit about our founding and background as a company. We'll go into a product deep dive of feedback we've heard from doctors and how we have incorporated that into our product, AI learnings, and future work. So I'm trained as a mechanical engineer, worked in management consulting, and really miss product development and building things. So I came back to MIT to go deep in that area. And I've had melanoma 3 times. So I decided to focus my thesis on problems in identifying skin issues in general and how technology can help, and learned that a massive number of people, 2.3 billion people around the world, have skin issues every year. About 2/3 of those cases are managed in primary care, and then about half of those are misdiagnosed. So we decided first to start with adult rashes for a lot of reasons, but a few of them are that it's easy or straightforward to image a rash with a smartphone camera. It's an ignored area. There's so much focus on skin cancer, but rashes have been pretty overlooked. And based on how we have built our product, we don't require FDA approval with how we provide results and a few other caveats. So what our product is, it's a simple tool for a doctor to be able to take a photo in a clinical environment, answer 3 simple questions, and instantly see their closest matches of the most visually similar conditions to the picture taken by that doctor, and then points them to additional clinical content, like how to rule a condition in or out, written, of course, by dermatologists in order to help them make the right choice for every person with a rash the first time. So our product saves about 3 minutes in an encounter, saves overall money by enabling that doctor to provide the best selection for that patient the first time, and our AI is on par with the accuracy level of a dermatologist. And how we were able to do that is we went out to build this product and just realized we couldn't find data sets like there are data sets in radiology or pathology for a lot of reasons. But so we got scrappy and built our database in the pandemic of over 500,000 photos from dermatologists in more than 15 different countries. This was really to create a large database that has high quality diagnoses and images, but also that's really actionable. So we brought in images of psoriasis and eczema and shingles, many different rashes across many different body parts and age groups, but also skin tones, which I think is really important here because not a lot of databases have representation across all different ethnicities. And so that's the product that we've built. How we built it, and I think one thing that I think we've done a good job of is really listening to different bits of feedback and trying to understand what are these physicians trying to get at, whether they're primary care physicians or dermatologists, and then trying to make smart choices about how do we implement them. And so a few different things that we've heard over the years and how we converted that into product changes. The first is we heard, primary care physicians say, hey, I really want to know what this patient's really most likely to have. And that's really driven by prevalence. But also, I really don't want to miss something critical and important that I should flag right now. And so how we implemented that was, the first methods that we used were like, okay, identifying, how prevalent is this? Is this common? Is this rare in our product? But, in our most recent iteration, we actually decided to separate our AI models of specifically rashes that are common and specifically rashes that are critical, because we heard this discussion so many times. And some of the reasons we did that is because in AI models, they are really tuned to how they're incentivized. And so if you incorporate prevalence in your AI system, and psoriasis is 100 times more likely than secondary syphilis, or 1,000 times more likely than secondary syphilis, the machine learning system is incentivized to always say it's the most common disease. And so we realized that we needed to give some sort of premium in providing results for critical conditions, otherwise they would just be overlooked. So we separated those models. The second thing that we heard, especially from dermatologists, was when they use our product in clinic, I think this was about 9 months ago, is that they said, hey, I took a photo of a patient's back and it said it was rosacea. And so I don't really know if I can trust your AI because, rosacea doesn't appear on the back, and that's a ridiculous and silly suggestion. And so what we did based on that feedback is that we added a body filter that, like, if there's a condition that only appears on one part of the body, like perioral dermatitis, that we do an additional filter beyond the visual search results to provide the most actionable diseases on that short list. And these are just a few of the examples of feedback, but sharing with you how we've helped had this feedback help us inform product choices. The third is we've heard primary care physicians say over and over again, can't I just take a photo and see the results? Why do I have to answer all of these questions? I don't have time. And so, I think the first version of our product had probably 8 different questions that we had physicians answer every time, which was like, is it itchy or burning? How old is the patient? How long has the condition been there? Has it been days, weeks, months? All of these different questions, and just found that primary care physicians really got frustrated and wanted to hear feedback faster. And so what we decided to do was we actually replicated the process a dermatologist goes through in evaluating a case into our product to have primary care physicians do the same thing. So how dermatologists address a condition is they first look at the condition, and they can see some information. In addition to the rash, they can see how old the patient is, where it is on the body. And then once they build the differential in the back of their mind, they say like, oh, psoriasis comes and goes versus another condition may be much more temporary. And so let me ask only very specific questions to evaluate just that short list of diseases. And it's highly customized to the case. And so we basically replicated this process in our product for doctors, to where we have them take a photo and answer 3 simple questions, including what body part is this on, with as few clicks as possible, in order to provide them AI results back very quickly. How we've used our product, it takes about 30 seconds. And then they can know what additional information to gather to identify what the most likely condition is. The last product area that I specifically want to share with you about today is we have had over 70 doctors test our product this year and provide feedback. And we'd always hear the same thing. We'd hear like, oh, I took a photo of my mole on my arm and it said it was a rash. And so I don't think I can trust it. As many people at this conference know, AI can be very effective as long as it's on a very narrow focused area. And so no matter how many times we told people, hey, it's just on rashes, they would still test it the same way. And so we actually built in a filter that when a photo is taken in our app, that we provide immediate feedback of if we think it's highly likely that they took a photo of a mole, to evaluate it. And to just say, hey, so sorry, we're not yet trained on moles, but feel free to use our product on rashes. And it was just, through seeing how people interacted with our technology and then learning what their expectations were for it really helped us, think about the end-to-end whole product and not just the AI feedback part of things when you simplify what we do. So now that we've talked about product and how we've deep dived on that, I'll go into a little bit about what we've learned in building our AI. So as I mentioned, we've assembled a massive database of skin disease photos, specifically adult rashes, in order to create these fast and useful results for primary care and other frontline providers. When we actually did a head-to-head comparison of evaluating our product at top 3 accuracy, we learned that just the AI alone has the accuracy level about on par with a dermatologist, and our product has even higher accuracy than that because we have additional filters, such as of like limiting what diseases are matches based on what body part is identified. And I think that that's important. One of the reasons is we still have to, that we only have the AI results in here is we still have to build the system to quickly evaluate our accuracy of our whole product. And so this is more fresh off the presses data for you. But we built our AI across more than 26 classes. But the reason we present it this way is because we've seen other work. There was specifically Google's team published dermatologist and primary care physician top 3 accuracy across different skin cases. And so just this is the most representative way we could show how we're performing. But one of our areas of future work is really to benchmark and understand what is the top 3 accuracy across 40 conditions and 50 conditions in dermatologists and primary care physicians to see how our product stacks up. But some of the things that we learned along the way in building this AI product is that we've tried various methods of machine learning principles and building the AI, and we learned that we really needed to take a data-centric approach, because even with the amount of data that we've brought in to date, it's still considered in the field a data poor environment. Another thing that we learned is that we really needed to check our AI for biases. As I'm sure you're familiar, there are many cases where an AI is fed photos of moles and the AI will end up picking up on the ruler in the photo or the purple circle around the lesion because it helps it identify the conditions that are more concerning. So in our case, what we were worried about was that our AI may have just been a body part detector, that it wasn't really looking at the rash, potentially, that it was just saying this is an elbow. And because it's an elbow, these are the most likely conditions. And if it was right, if it did effectively do that filtering, it could have increased accuracy, but without training specifically on the condition. And so, so we used a pixel level method of doing semantic segmentation. So in our machine learning models, every single pixel has a designation of is it likely to be a disease, is it background, is it healthy skin, in order to be able to quickly and easily audit our results with a heat map. And so we see heat maps generated for each condition and healthy and background information every time. And the second thing that we learned was really important was additional labeling. Dermatology photos that are taken on Nikons or with potentially Kodachromes or with smartphone cameras all have variation in lighting. Just like part of one side of my face is better lit, that can mess up your machine learning algorithms. And so we brought in all of this data, and it came with a single diagnosis from the dermatologist that shared with us that case. But we really needed to add additional labeling, like segmentation of a photo. So, teaching it, hey, here's background, here's healthy skin, here's diseased skin, adding what body part it is, of course, adding the skin tone of the person in the photo, adding what's the photo quality, in order to be able to make a highly accurate product. We just needed to provide it a lot more context clues, because like the backgrounds and we brought in this data from so many different sources that we needed to help the machine learning model out as much as we could. In terms of future work, we definitely have done a lot just with a team of 5 people to date, but we certainly have a lot of work to do. So one of those areas is, of course, clinical validation proof points. We've had physicians, dermatologists and primary care physicians using our product in clinic and getting continuous feedback on their evaluation of it. But we really do want that, as real world as possible evaluation of our product live in a primary care setting with a smartphone, in order to be able to benchmark how useful it is, and then how we're helping to inform their choices. The second area is just benchmarking true primary care and dermatologists, top 3 and top 5 dermatology accuracy. We have an example of one study that we've benchmarked against for top 3 across 26 conditions. But we really, one of our next steps is to run an internal study and evaluation over the next 2 months to get some baseline data of this, and then run a bigger evaluation study with an academic medical center. The third is, of course, trying new machine learning methods. We've built our system using transfer learning and then tailoring the application specifically to dermatology. We still want to try many different methods, including what if we just trained it on individual body parts alone and said, we want to make an AI that's really good at elbow evaluation and chin evaluation to account for some of the curvature of the body and other factors that matter in the clinical encounter. Other methods like that, of course, just trying out new and experimental methods in order to improve our AI accuracy. And then the last area is, of course, expanding our database. We have built a large database and have made some great progress, but we want to always add more conditions, adding especially more critical and rare conditions that primary care physicians are worried about missing, getting more cases across, the specific buckets of conditions that we don't have as represented. And of course, continually investing in our data helps invest in our accuracy. And that's the most important thing to physicians in trusting that our product can help them. Thank you so much for your time today. I'm Susan Conover, co-founder and CEO of Piction Health.